if I may welcome Andreas Bovens to the stage. And you're going to talk to us about elevating mental health and the power of video calls. As Andreas is head of media platform and developer marketing at Whereby. Thank you very much.
Thank you. I will need a clicker, I believe. Thank you so much. All right, great. Let me stand here. Hi, everyone. I realize I'm the last person standing in between you and a delicious lunch, so I'll try to keep it short and snappy. My name is Andreas Bovens. I'm head of media platform and developer marketing at Whereby. I'll talk a little bit more about Whereby in a moment. But I must say it's really a pleasure for us to be here, to be sponsoring this event, and to be partaking in this track about digital mental health. I'll be talking about the power of video calls and how they can help elevate mental health. A little word about Whereby. What we do is we provide a video conferencing platform. And you can think of it a bit as something like Zoom or Microsoft Teams, for instance. But unlike those platforms, you don't need to install anything. You just need a web browser to access the video call. The user will then give access to their camera and microphone and can just get started and talk with whoever is also joining the same meeting room. When developing our platform, we spend a lot of attention, or pay a lot of attention to making the user experience very straightforward and kind of the meeting room very easy to use, easy on the eye, and not too overwhelming, unlike some of the other platforms. So you see here this green background color, easy to understand buttons, accessible UI, and so forth. And so what we've seen is that there is quite a bit of demand for embedding these kind of meeting rooms inside of other applications. We provide a developer API that developers of platforms can use to embed video conferencing capabilities as a module or as a component inside of their applications. And so this is being used, for instance, by a number of mental health startups, such as Bravo, which provides a digital mental health platform in Italy. There is Vitude, who does this in Brazil. Wellnight is a US startup that provides digital mental health counseling. And also Mindu is another customer of ours, which is based out of Finland. And so all of these companies provide digital mental health platforms, and the video conferencing module is essentially powered by Whereby. So if you allow me to take a step back, take you back to the beginning of the pandemic, not the most pleasant of times, as we all remember. And back in March 2020, April 2020, a lot of our lives switched online. We had in-person conversations that suddenly became virtual conversations. And so that was also the case for patient-doctor consultations. And I think it's fair to say that the pandemic dramatically accelerated the shift to online consultations. They were happening to a certain extent before that, but definitely at a faster pace because of the pandemic. Once the pandemic subsided, ended, so to speak, there was a return back to in-person meetings. And I think, according to a recent survey, about 71% of patients actually prefers to meet their doctor in person rather than virtually. But virtual mental health appointments remain popular, and we see them continuously growing. So that is very interesting. And just to give you a bit of proof, this was a recent survey by CareNet Health, which looked at US consumer trends in patient engagement. And they said, and I'll quote here, among those who are open to telehealth for some providers, primary care, so their first point of contact with a doctor, and mental health, 45% are the most commonly preferred virtual appointments. We see this also in when we look at customers using our platform. Some of the digital mental health providers, they have been growing enormously. So this is sort of a timeline, a trend line, showing you the growth of some of these digital mental health platforms. And I'm looking here at participant minutes. You can think of this as time spent in minutes. There's no value shown here on the y-axis because of confidentiality reasons, but you can, I can tell you that this amounts to millions of participant minutes per week that is spent, that users and doctors spend on these platforms. I wanted to conclude this section with this typical hype cycle graph. This is provided by Bessemer Venture Partners, so they look at the health tech space, sort of very much from an investment perspective, but I thought it was quite fitting here. And so this was featured in their State of Health Tech 2023 report. And so you see there that when COVID started and everything shifted online, there were enormous expectations, actually inflated expectations about all the things that health tech could do. And then there was sort of a realization that it was not all very rosy. And so we went through a trough of disillusionment, as they call it. And now we sort of reach a plateau of productivity. And I think that digital mental health is definitely sort of has reached a plateau of productivity. We see it works well for that particular area. So, why are these virtual digital mental health sessions, these consultations, so popular for mental health? First of all, I think I'll go here to a couple of points. The consultation format, where there is a doctor talking to their patient and listening to their patient, is a perfect fit for having a virtual session. There's no need for the doctor having any physical interaction with the patient, and instead it can just perfectly well handled because it's all conversation-based online. It offers improved accessibility to the right specialists. Sometimes patients are in remote areas, in rural areas. They have difficulty finding the right specialist. Doing this digitally, of course, allows them to access the right specialist. It's also convenient for customers, for patients. It saves them time. And there's also the thing that the overall experience feels less rushed. They don't have to arrive in a meeting room where they see a lot of other patients waiting, perhaps schedule is overrunning and so on. Because these meetings are typically very time boxed, it feels like the therapist has enough time for them, and it makes for a much more comfortable experience. And because this allows digital mental health consultations allow to spread the load better across different specialists, it also leads to reduced overwork and burnout risk for therapists. So there's also clear advantages for them. I didn't come up with these reasons. They're referenced here. I will share the slides later on. They're referenced in a recent report published on BMC. So they also seem to have a positive impact, these digital mental health sessions. This is from a press release by Timely Care. Timely Care is a digital mental health platform that provides these services to students in universities in the US. And they said that 75% of college students who accessed virtual mental health and well-being interventions, these include virtual therapy sessions as well as other types of exercises, reported mental health improvement, including 100% of students who presented as a potential suicide risk. So that's, of course, a great result. So, having worked as a provider with a lot of these digital mental health platforms, we are in regular conversation with them, and we've learned quite a couple of things about how they like to set up these video conferencing rooms. And so I wanted to share some of those insights we've had over the last couple of years working with these providers. The first thing is that embedding these calls inside the platform really increase patients' trust. It makes it easier for them because they don't have to install or download additional applications, and they really know that when they log in to the system that they signed up for and can take the call there, that it's actually the therapist they're talking to, and it's just a much smoother experience for them than, let's say, going to a therapist, making an appointment, then going to Zoom, then back, and so forth. So having all of this in one integrated experience has clear advantages. Because there is no physical room, the virtual room sort of takes the place of a physical room, and so the layout there, the configuration, the color palette even shapes the whole experience. And this is why, as I said in the start, we spend a lot of time focusing on the user experience and making for a very clear and easy to understand, calming user experience. What we also found interesting, that is that a lot of therapists and therapy platforms prefer to put the self-view here as a small self-view in the bottom right corner. Why is that? It allows the patient to focus, to put their full attention on the therapist and the therapist on the patient. If we have both the therapist and the patient side by side, you tend to start looking at your own image instead of at the therapist, and so it makes for a less fruitful session. And this is my last slide of learnings. We found that noise reduction, which eliminates background noise, and background effects, which allows users or patients to replace the background behind them with a custom image or blur it out. It gives them agency, and it allows them to take sessions, mental health sessions, where otherwise they wouldn't be able to do so because of their environment not being ideal for it. So it allows them to still do this and go ahead with it. We also found that cell phones are used in over 50% of sessions. Over 50% of sessions have at least one person using their cell phone to call in. So they don't do this from their laptop or desktop. A lot of people use a cell phone. They might be at home, they might be also on the go, which of course brings additional challenges when it comes to bandwidth and poor network situations. So we spend a lot of time in optimizing voice over video. For instance, when the network is constrained, you are fine maybe with dropping some frames, but you want the voice to continue to be crisp and the therapist and patient to be easily heard. And then the last thing, and this is just more like something we're currently working on and where we see a lot of potential, is that there's a lot of exciting potential around automatic meeting transcriptions and also clinical meeting notes using AI. So we see a lot of potential there, and of course a virtual setting is ideal for this. Both parties have a microphone right in front of them, so it's easy to capture meeting notes and turn them into a summary, a structured summary after the meeting that then can be used by the patient or the specialist. So this concludes my talk. At Whereby, we're very passionate about video conferencing, as you probably can see, and we're really excited about the potential it can bring to digital mental health platforms. If you have any questions, feel free to catch me or some of my colleagues. They're in the back there during the break. They're waving right now if you want to see them. Okay, thank you very much.
Questions now? Has anybody got any questions now for Andreas while he's on the stage? Or? Lunch beckons, I think.
No
Andreas,
problem.
thank you very much.
Thank you very much.
It's a great pleasure.